Welcome to Total Joint Care, non-invasive alternatives to care for arthritic joints. This is part one, the overview. There's a few objectives for this presentation. What I want to do is be able to provide you with some evidence-based treatment options that you may or may not be familiar with for the treatment of arthritis that you can use in discussing with your medical providers about the best course of treatment. This is called shared decision making. The second is to discuss common myths regarding osteoarthritis, pain, and activity. Third, to learn how lifestyle factors are an integral part of care. Four, to gain a deeper understanding of just how pain works. And five, to practice some behavior change strategies. Getting started with any change can be challenging, so we'll provide you with a few helpful strategies along the way. Everyone who's attending this lecture is here for similar reasons. You've been diagnosed with arthritis in your lower body somewhere. Surgery was probably not the first option for whatever reason, and you're considering alternatives to managing or treating your condition, or you just want to be proactive. So here's the program format. Phase one is all about education. The on-demand content will be available through the Force platform. It's recommended that you go through these topics in the order listed the first time through. The second phase is the exercise portion. This will be done virtually through the Force platform. These sessions were developed by a therapist in the rehab department. The great part about this being done virtually is that you can always go back over any parts that you've missed. So here is a partial list of some of the alternative treatments for osteoarthritis. Those listed in blue at the top are ones that we're going to be talking about specifically in this program. They also have good evidence for them. So let's talk about shared decision making. It's important to realize that each person, each situation, each kind of arthritis is different. What works for a neighbor or a coworker, for example, may or may not be appropriate for you. Even your medical providers may have strong opinions or bias based on what they've seen. Good care is going to consider the whole person. And finally, every option takes work, whether that's changing your diet, your exercise habits, or the care required, the rehabilitation required after surgery. It all is going to take work. So how do we go about making these decisions? Here's some questions that I think might be helpful. What abnormalities or severity of joint change is present? Has the alignment of the joint itself changed? Do you plan on using medication to support pain relief? Or do you plan on using supplements? What are the barriers to and motivation for lifestyle change? Will time be a factor? Finances, support from a spouse, etc.? What are your expectations for pain, function, and how long are you expecting it to take to see change? How much work is going to be needed on your part to achieve those expectations? Have other sources of pain been ruled out? So not only relying on just the x-ray. And what does the evidence support? How might your situation be unique?